Prostate gland, we typically, as urologists, call it the sex gland. It kind of sits between the bladder and the urethra. It's in continuity with the urethra, and it provides the nutrients or the fluid for seminal fluid. And basically, it combines with the sperm to kind of protect the sperm in its pathway towards fertilization. So it's an excretory gland that is, and that's its only purpose, is to kind of protect the sperm as it goes towards fertilization. Well, it's hard to say. You know, the one thing that we say a lot in medicine is that you can't beat your genetics. So certainly, if someone has a significant family history, you definitely want to at least kind of put yourself in a position where you're least likely to get it. So, and it really goes to follow that it comes with things like maintaining a healthy diet, maintaining your weight, regular exercise, all these things that are kind of healthy habits in general are certainly things that can lower your risk a little bit of developing prostate cancer. But when it comes to absolutes, there really are no absolutes, and that's why we really stress that people should get screened when they're of the appropriate age for screening. So the one thing that we can kind of say in general is that a younger patient, certainly someone below the age of 60 that's in fairly good health, the first choice is going to be surgical treatment. Because when you talk about the other treatment modalities, those are treatment modalities that keep the prostate in place. So the longer that you have to live, at least by stats, the better chance is that someone's going to suggest removal of that prostate. So there's a little bit less risk of recurrence. So the first choice is going to be surgical option or radical prostatectomy. Now, there are some patients, though, that would choose not to have surgery, or for whatever reason, they may not be a good candidate for surgery. So the radiation option then would be appropriate for these patients. Well, a clinical trial is a research study that uses human subjects, and generally they're trying to answer a question as to whether or not a treatment modality or a medication is effective. And so they'll take these subjects, they will take them through this treatment modality, and they do it actually in phases, where they first try to make sure that whatever treatment that they're studying or whatever medication that they're studying is safe. Then secondarily, they'll do a slightly larger trial where they're trying to figure out dosage and efficacy, whether or not they need once-a-day dosing, twice-a-day dosing, trying to look at what kind of side effects there are and at what level the side effects come. And then on the third phase of the trial, they're usually comparing that medication or treatment modality to an established medication or treatment modality to see how efficacious it is and whether or not it's safe enough and efficacious enough to be put to market.